Good afternoon, everyone. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two. I'm author of, wrong shoulder, A Life, a Finger, a Pea Up, a Nose, a practical guide to baby and child first aid. And I'm also founder of CPR Kids. And at CPR Kids, we empower parents and families with the life-saving skills of baby and child first aid and recognition of the sick child. And today we are talking about dental injuries in children. What I would love you to do is if you can give me a thumbs up or a wave just to make sure that all the technology is working as it should. And please, this information we want you to share with everyone. If you tag any friends that you think might be interested in knowing this first aid, please go ahead and do so, because the more people who know how to help our little ones, the better it is. So today we are going to be talking about dental injuries in kids. Now, what I'm going to talk to you from is particularly the recommendations from the Australian Dental Association. It's really important that, we are following the experts' guidelines here, and we're talking about what to do in a first aid situation. So first of all, what I'd like to do is talk to you about the little ones with baby teeth. Now, I don't know about you, but my two kids would just smack their heads all the time on everything, and it was just a matter of time before they ended up with a dental injury. We've had two in the house. The first one, and please don't judge me, okay? No, we're in no judgment zone here at CPR Kids. Yes, paediatric emergency nurse. Yes, have done things to my kids that is not desirable, all by accident though, of course. So my oldest one, when she was around 18 months old, I got her out of the bath, stood her in front of me, and I just washed her hair. So I got a towel and I was drying her hair, and she was just yelling like a banshee. She was just all over the place, waving her arms. No, don't touch my hair. I do it. And she was just going a bit crazy. And so I said, fine, no problem. And so I took my hands off her head just as she was launching herself forward, and she hit the bottom of her chin here straight into the corner of the bath, and her teeth went straight through the bottom of her lip. So, of course, there was blood everywhere. So, firm pressure underneath here to stop the bleeding. And the cut itself wasn't too bad, but once she actually, through her fat lip that she also had, I was able to have a look, calmed her down, pulled that forward, and you could see that the two little bottom teeth that she had there were actually pushed down into the gum. So she didn't actually lose her teeth, but they had become impacted. And so it's a really important thing that we actually realize that it's not just about teeth coming out that is a dental injury. It's also about any kind of injury that happens to the teeth, whether they're chipped, whether they're split and broken, or whether they're impacted as well. So we needed a trip to the hospital. We needed to have this cut under here looked at, and we also needed a paediatric dentist to have a look at her teeth that were impacted into the gum. So she was quite lucky. She didn't need to have any stitches, just a few little steri strips on the outside, and the inside of the mouth, that usually heals pretty well. So that was okay. But with her little teeth there, what happened is that they weren't quite impacted enough to need removing. So they were just there. They were a little wobbly. They were the first ones of hers actually to end up falling out, and they did change colour. So they didn't stay the nice little white teeth that they were. They actually went this really kind of odd brown colour. But her teeth that were underneath were fine. So we were really lucky in that sense. So what do you do? So really important, if it is the deciduous teeth or the baby teeth, so deciduous meaning the ones that fall out. If your child has a dental injury where they've hit their mouth, obviously we need to stop any bleeding that's there. So being able to put some pressure on there is important, okay? So particularly if a tooth has come out and they're bleeding a lot, we don't want them swallowing that if they're, because they can it won't do them any harm, just might make them feel a bit sick and they might just have a nice big vomit. Now, how do we stop the bleeding? If your child is old enough, you can actually get them to bite down onto a face washer. if they're old enough to do that. Otherwise, it's just about leaning them forward, seeing if you can put a little bit of pressure on there to try and stop that. Hopefully it'll stop rather quickly. With the teeth, if they are impacted into the gum, you need to go and get on the phone to your dentist. If your dentist isn't open, there are lots of after hours dentists. If you're in a regional area or rural area, get onto Health Direct, try and find out what's around near you, because time is of the essence here. If their baby tooth has come out, then it's really important that you do not try and put that back in, that you simply, what you can do is put the tooth in saliva or milk, so you can spit into a Ziploc bag. Gross, I know, but you can't actually put the tooth under running water or put it in water. And when you handle it, it's really, really important that you don't touch the root of the tooth, that you only handle it by the crown. And the crown is simply the bits that you can see here. So just the tip of the tooth there, don't touch the root. So remember, pick up that tooth, all right, if it's there. Open up a Ziploc bag. Always have these in your first aid kit. First aid kit in the car, first aid kit at home. Always keep some Ziploc bags in there. Spit in there, saliva, pop the tooth in, or milk. Zip it up, off to the dentist. Or if it's the middle of the night, they've fallen out of bed, then it's on the phone to the advice lines. So really important, baby teeth, do not try and put them back in the mouth, because it can cause damage to the new teeth that are under there. So it's really important. And the other thing is as well, is they're not going to try and put another baby tooth back in, to be completely honest. That's not going to happen. So what do you do if it is a grown-up tooth? So once, certainly I had one child who was losing her teeth in kindy, and much to the other one's disgust, she didn't lose hers until grade 3. So she was really, really cranky about that. So all kids are different, just like they're different when they get their teeth coming through. They're same, for the first time, same with the grown-up teeth as well. So when it comes to permanent tooth, so not a deciduous or baby tooth, but a permanent tooth, what I would like you to do, first of all, find the tooth, okay? Pick it up by the crown, not the root. That's really, really important. And you're going to do the same thing. You are going to rinse it in milk or saliva if the tooth is dirty. If it is not, you're going to take that tooth and you're going to put it straight back into the socket where it came from. I know it's a bit daunting, isn't it? But, if you've got a cooperative child, then absolutely try and do that. If your child is not cooperative, if they are freaking out by it, don't try it, because the last thing you want is for them to have a panic and swallow the tooth. That is not a good thing, okay? You want that tooth because it's expensive to replace them, and hopefully the dentist will be able to replace it. So get that tooth, pop it straight back into the socket. Get your child to bite down onto a face washer, just gently, just to try and keep any bleeding under control and keep that tooth into the socket where it is. Now, if you cannot put it back, then it's the same thing again. You're going to spit into that Ziploc bag and pop the tooth in there, or you are going to put it into some milk and it's off to the dentist. The sooner you can get there, the better the chance it is of having that tooth actually successfully replaced back in. And that's a really important thing. So please keep Ziploc bags in your first aid kits. First aid kit in the car, first aid kit at home as well. So that's really, really important. And you know what? You don't have a Ziploc bag with you. What I have seen done in the past, and the Australian Dental Association, this isn't part of their first aid, but it is something that has been done very successfully in the past, because sometimes you've just got to do what you've got to do. I know a parent whose tooth was knocked out on the footy field, who picked it up and just tucked it into his cheek because you needed it in the saliva there. They didn't have milk, they had nothing with them. Tuck that in there. It actually was successfully replanted. You just got to be careful not to swallow it. And it's really not advisable for your kid to do it either, because children are just too unpredictable. I don't know about you, but I've got an 11-year-old and 9-year-old, and they have trouble enough not swallowing chewing gum, let alone a tooth. So really important. Sometimes you just got to do what you got to do. But the important points here, just to recap: number 1, don't try and put a baby tooth back in the socket. Milk or saliva is important. Zip it up and seek urgent dental help. Even for teeth that are impacted, it's important that you seek urgent medical help for that. And try and stop any bleeding just with firm, direct pressure. Get them to bite down on a face washer if it is age appropriate for your child. For a permanent tooth, if you can, get the tooth straight back into the socket. Off if, obviously if it's covered in dirt, don't do that. Hold it by the crown only, not the root, and you can rinse it in some milk, rinse it in a bit of saliva if you can. It's gross but important. And then if you can, pop it straight back into the socket. Get them to bite down on a face washer, fantastic, and then off to emergency dental treatment. If you can't, pop it back in the socket, into that Ziploc bag again with saliva or milk in it. And remember, do not touch the root. Do not scrub the tooth. Just give it a quick little rinse in that milk if you're about to pop it in. So that is dental injuries in kids. So what I would love you to do is that if you have another subject that you would like us to talk about, please type in the comments here below and let us know what you would like us to talk about. And if you have any questions at the moment, please type them in the comments. And what I would also love you to do is, today is the perfect day for you to book in to a first aid course specifically for babies and children. Not only are you going to do that today, you're going to get some Ziploc bags and put them in your first aid kit as well. That's important. But you know what, whether it's with CPR Kids, whether we can help you find another provider, please don't put it off for any longer. Please, please, please enroll in a paediatric CPR and first aid course, because you will never regret 3 hours learning these skills. But you don't want to be in a position where you do regret that you never learned them. So if there's no questions, we'll sign off for this afternoon, and look forward to seeing you for our next Facebook Live. Okay, see you later, everyone. Bye-bye.